Welcome and thank you for joining us this morning for Issues and Views, Buffalo, New York's weekly public affairs program focusing on topics and concerns that affect you and your community. We hope the information you hear today is beneficial to you. Now here's your Issues and Views host, Todd Anderson.
Good morning and welcome to Issues and Views. I'm your host, Todd Anderson, and we're honored to have as our guest this morning Dr. Gale Burnstein. She's the Erie County Commissioner of Health. And Dr. Burnstein, how are you today?
I am doing well, thanks. How are you?
I'm doing well, thankfully. So we are in the midst of a pandemic, and just want you to explain what Erie County residents need to know about this disease.
Well, what I would like Erie County residents to know about COVID-19 is that it is widespread in our community. And many people can be infected that are both symptomatic with fever and cough or difficulty breathing. And many people can be infected who don't have any symptoms or just some mild symptoms. And so that's why it's really important for Erie County residents to be aware that anytime they go out and they take essential or non-essential travel, they could be exposing themselves to COVID-19. And that's why it's really important that we have to be vigilant about practicing good social distancing. So no guests in the home, no going out to other people's homes. When you do go out for just for essential travel, like if you need to go to the grocery store to get collect food, which we all have to do, make sure that you stay away from other people in the aisle. You might want to wear a mask to give yourself some additional protection, or wear gloves. And when you take the food home, you want to wash it off and with good disinfectant, including the packages and the produce. Just make sure that because you don't know what the other person what was on those other person's hands
right,
that touched it before you, and then also making sure that you wash your hands as much as you can. I mean, you don't know what was on the hands of the last person that touched the doorknob or a pen or a handrail or anything. So it's really important to make sure that you wash your hands as much as you can. And then also in your home, you want to make sure that if somebody is sick, that they stay in their own room, and you can put them in like quote unquote isolation. And so what that means is literally they are isolated from the rest of the people in the home. And if you're suspicious that they have COVID-19, you can call your healthcare provider and discuss their symptoms and in a plan for that individual. But basically, they should stay in their room by themselves. If hopefully that's a possibility, that there's a room in the home that people can stay by themselves, and then hopefully they can so they can have food brought to them, placed outside their door, and then when they're done with their food or their plate, they can leave it outside their door. And then with the laundry, you could give them like a big plastic bag to put their laundry in, and then that can be directly emptied into the washing machine, either at your home or a laundromat, and wash with really no or minimal touching. And then if you touch something, of course you can wash your hands. And so those individuals in isolation would be best that they have use their own individual bathroom if they can. If they can't, that they make sure they wipe it down with good disinfectant after every single use, and wash your hands. And the next person use it, make sure that they wash your hands really well too. And then, since this may be an issue for a while, we want to make sure that people have a good plan how to handle that. So I think we can just assume that it's going to happen to every single household. So we have to make a plan and plan ahead. So when it does happen, we'll have everything in place. So if you're a caretaker of people in your house, whether it be young kids or an older adult or somebody else that may have some disability or chronic health problem, and you become ill, you have to make a plan with who's going to take care of them. You have to figure out what are the resources in the community that you can call, or your neighbors that you can call, or know the phone numbers where to get food, the grocery store to get or whatever you need to use, or online to get food delivered, or and all the pharmacies now, at least the chain pharmacies, are offering free delivery of pharmaceuticals. And you have to know what your resources are in case this does happen, because I think we have to assume that it's going to happen to all of us because there is so much COVID-19 in the environment right now.
Very good information. Dr. Burnstein, I do have a couple of questions. You see a lot of kids outside playing, and no one's really addressed that, whether that's a good idea for parents to let kids go out, because I see them in groups playing basketball and football in the streets and so on and so forth. How would you, what kind of advice would you give parents regarding that?
Well, again, we want to try to evolve. If we want to try to prevent any type of mass gatherings or group interaction. So, if kids want to play some sports, if they can find a large field and kick around a ball, make sure that or throw a ball, make sure that they're 6 feet away from each other, and then make sure that they have good hand sanitizer on hand, so they can, after they're done throwing the ball, or it'd be actually better if they could kick a soccer ball around, then they don't have to worry about contact with their hands. They have good hand sanitizer around to wash off their hands. And again, they should be on the different 4 quadrants or in the periphery, so they're at least 6 feet away from each other when they're kicking or throwing a ball around. Or they could do maybe set up a hockey net, and again, make sure that they stay at least 6 feet away from each other when they're taking turns shooting the puck. But again, and then kids can, if they go on a bike ride, they really should go by themselves. Or if and again, another strategy is that many times within households, brothers and sisters are getting in close contact to each other every day. I mean, you're living in the same house, and so going on a bike ride, you should prefer, or walk, preferentially go with your family members instead of your friends. And there are also, games that kids can play in their own room with groups of friends. Like my kids, they play some online games with groups of friends who are all on their laptops at home in their rooms, playing together as a group activity of online group gaming. And so that's also another option to do for kids to partake in group activities at this point. But it really have to have physical distancing in whatever we do.
You keep hearing 6 feet away, 6 feet away. Just say hypothetically you're 5 feet away, and like in a store aisle, and you pass by someone, you don't necessarily touch them. Is this virus airborne? Is it that airborne such that if you're within 6 feet of someone, you can get it without even touching the person or touching anything?
Well, again, we think it's believed that it's spread through droplets, and so if somebody is speaking or coughing or had just done that, then there's a possibility you could have been exposed. Again, it's a continuum, so the farther the distance, the more protective.
Okay, and also, can you address gloves? Once again, people are wearing gloves. I have some gloves, but you're in the store, you're touching things and so on and so forth, and you're protected. But then you go out to the car, you open your car door with the gloves. What's your advice regarding gloves?
Right. Well, you want to make sure that you when you put on the gloves, you want to make sure that if they've been used before, you avoid touching the outside of the gloves with your hands. And then when to remove the gloves, again, you want to make sure that you try to avoid touching the outside of your gloves. So if you're going to be touching something that you frequently touch surface, you want to remove the gloves before you touch that surface, like your car door, because then that will be contaminated. And then regardless, when you after you remove the gloves, you should still wash your hands with either hand sanitizer or soap and water, because again, you could have touched the outside of your gloves and may not have noticed it.
Right. And one other important thing, I know you mentioned if someone is sick, they should quarantine themselves, stay away from everyone else. But what if that person gets to the point where they need to go to the hospital? That becomes kind of tricky at that point, because they have to be transported to the hospital. So how do you do that?
Well, if a person needs to be seen in the hospital, they definitely have to get there. So right now in our county, our hospital dispatchers are aware that this is a problem in our community. So when they call 911, they should alert the call taker that you're concerned that this individual may have COVID-19 or maybe have been diagnosed already, and they will take the precautions. I mean, right now, I think most ambulances and EMTs are assuming that everybody could have COVID-19, but if you definitely have the symptoms of a high fever and either a cough or difficulty breathing, shortness of breath, you should let them know that, and to make sure that they will take the appropriate precautions. And then when the person arrives at the hospital, the hospital will take the appropriate precautions and make sure that individual is ushered straight back to an exam room, and that the hospital staff will wear the appropriate PPE. Also, if you feel that you don't need to call 911 and you can take that individual to the hospital in your car, again, call ahead, let them know that you're coming, and let them know that this individual has symptoms consistent with COVID-19, and so again, they can take the appropriate precautions when you arrive.
Right. Well, that's kind of my question. How do you take them in your car, or do you call an ambulance?
Well, it's probably safer to call an ambulance because, again, they have the appropriate PPE. If you do decide to use your car, I mean, you take the risk of somebody quickly deteriorating in the car ride, which just a lay person may not be able to fully treat or address. And then also you have to make sure that you clean up the car afterwards with good disinfectant in the area where that person was sitting.
Okay, well, very good information once again. Where can listeners find more information, Dr. Burnstein? We're running out of time here. I know I only have you for a few minutes, and then I'm going to talk to Dr. Kirsten Vincent as well. So what can listeners, or where can listeners find more information?
Well, there's great information on our Erie County Health Department website, and we actually have a specific COVID-19 website. So go to erie.gov/COVID-19, and that'll take you to a lot of great information. Also, the New York State Department of Health and the Centers for Disease Control and Prevention also have some really great websites with good information for both for people in the community and for healthcare providers. So I strongly encourage people to look at those sites. If they can't find the information there, or they have they don't have a computer or have difficulty using it, they can call our Erie County helpline, or our COVID-19 helpline at 716-858-2929. Again, it's 716-858-2929. And then we have callers that can provide a lot of good factual information. So if you have if you're asking questions about your own personal health, the call takers will not be able to answer those questions. You should call your healthcare provider for that. And also, if it's a hypothetical question, again, the call takers will not be able to answer those type of questions. So, those are really great sources of information.
All right, I appreciate that. And just so our listeners know, and just so you know, this program airs on all four of our Town Square Media radio stations, WYRK, The Breeze, Jack FM, and WBLK. So any of the listeners to any of those radio stations, we also have information on each of the station's websites, and I believe we have links to everything that you just mentioned, Dr. Burnstein.
Great.
I want to thank you for your time. I know that you're very, very, very extremely busy, probably never been down this road before, and we really appreciate everything you're doing, and thank you for your time today.
Sure. Well, thank you. Thanks for delivering the message.
We want to thank Dr. Gale Burnstein, the Erie County Commissioner of Health, for her time today. We also have another very important person regarding COVID-19 and the coronavirus. Dr. Kirsten Vincent is the interim CEO for Housing Opportunities Made Easy. HOME is the acronym. Dr. Vincent, thanks for joining us today.
Thank you for having me.
Dr. Vincent, what advice can you give people who are feeling stressed and anxious about the current state of the entire world, actually?
I would say that, right now there is just a lot going on, and feeling stress and anxiety is natural, but there are a few things that we can do to help reduce that. The first and foremost is it's important to stay connected, but it's important not to go on information overload. Don't watch the news 24/7 because once you do, then it's just all that's on your mind. And if it's always on in the background and you have kiddos at home, then it increases their anxiety as well. So you want to check in, be informed, especially with your local news, but you don't want to, like I said, you don't want to have it on 24/7. You want to get information from trusted sources like the CDC and the World Health Organization. And if you're starting to feel overwhelmed, then you definitely want to take a break from any type of media. It's also important that, during this time, it helps us to, make sure that we're helping other people. So sharing information is good, but you want to be careful what you share. Getting your information from social media isn't always really accurate and can increase people's anxiety. So, make sure you're connecting with someone, sharing what you know, but make sure you're getting things from a reliable source.
Yeah,
and, you want to make sure that you're focusing on what you can control, because there's a lot of things going on that we cannot control.
Right. Very good advice, because watching the news, I'm an avid news watcher, but watching the news and on social media, it can become seriously overwhelming.
Definitely. And it's on everywhere. You can turn on 20 different channels with it on all the time.
Exactly. Now, can you give some people, so can you give our listeners an idea of some positive ways to relieve stress?
Sure, definitely. Like I said, you want to, understand that there's things that you can control and the things you can't control. But when you focus on the things you can control, that generally makes us feeling better. All of the advice that Dr. Burnstein has been giving out, and all of the medical professionals, following those guidelines, those are things you can control. And you want to plan for what you can. Sometimes writing down the things that you're concerned about, kind of putting them in lists, kind of helps us keep things sorted, and just makes us feel that, we really do have control over, all of the things that we can. Self-care and self-meditation are incredibly important right now, but I think one of the most important things is staying connected. We can still be together even though we're apart, so making sure that we're calling people, texting, people that we care about, FaceTime and other forms of video chat have become, really important. So my family and I have been having virtual family time. So, we start a group video chat, and even though we are, not able to be in the same houses right now because we live too far apart, at least we can see each other, and we can talk with one another. I am not always the biggest fan of social media, but right now I'm kind of glad it's around. It's it's another way to stay connected,
right,
but not for the news. Again, it's being connected in a positive way with people that you know and you care about.
Right, exactly.
And I think, too, developing and making sure you're sticking to a routine. If you are suddenly working from home, which is not your normal routine, it's important to still get up, get dressed like you're going to work, even make your lunch, even though you're going to be eating it at home, and, have a workspace that's, as separate as it can be, so that when you are done with your work, you can kind of leave that behind and go back to your family life. And it's really important to set up those boundaries. That really does help us to stay healthy. There's things like virtual book clubs, virtual recipe clubs, a lot of things that we can do to stay connected.
Right, and diet and exercise probably very important as well, because I'm working from home and I find myself wanting to eat every 2 minutes.
Yeah.
So diet,
snacking can happen. They talk about the freshman 15. I think that I'm going to end up with the COVID 15 if you're not careful.
And exercise also very important, even if you do just minimal exercise, right? And you can still go outside and go for a walk.
Yep, you can go outside. If you have a dog, take your dog for a walk. Go outside. With one or two other people. Just not large groups of people, but take a walk. If you've got a balcony or a patio in your house or your apartment, and the weather's nice, open the doors, get some fresh air in. Yoga, I am a big fan of yoga, meditation, any of those things that help you kind of center and clear your mind and help you just feel better. The other day, my friend, she just needed to get out of the house. She and her husband went for a drive. They didn't go anywhere specific. They didn't stop and do anything. They went for a drive for 15 minutes, and it really helped them feel better. Also want to say it's really important not to self-medicate at this time. That, drinking, anything along those lines they're those are depressants. They do not help when we're in these kind of stressful situations.
Right. And you mentioned going for a ride. I remember doing that back in the day. People used to do that. And there are a lot of things that, I'm a little older, but there are a lot of things that used to take place when I was a kid that no longer take place. But this disease is not a good thing, but it has brought about some good practices and with respect to families.
Definitely. And, there are ways, like I said, with your family, that if you're home with your family, you can play games, you can read books together, you can, watch a movie together. But if you're, far apart, there's ways to stay connected to your family too. My son, he's older and, he lives, kind of far away, but we've set up where we can play online video games together. Right. So even that, is a great way to stay connected to people.
Right. Hey, I want to give you an opportunity to say something about HOME, which stands for
Housing Options Made Easy. But we are changing our name and about to become Recovery Options Made Easy.
And what do you guys actually do?
We are a non-for-profit agency that supports people with mental health issues. Our original mission was to help people find safe and secure housing, but we now have expanded. We have recovery centers. We have 24/7 crisis intervention programs, crisis respites, call lines, text lines, virtual support lines, as well as partnering with other agencies to do other crisis services programming.
If someone is a little stressed out regarding COVID-19 or the coronavirus, and they just want to talk to someone, do you guys provide that type of stress relief or mental health relief? Is there a phone number someone can call?
We do. So my agency, we have a 24/7 peer support. It's called a warm line, just a number where you can call and just talk to someone. That's locally, that's 716-749-3848. And then we also have a toll-free number, which is 844-749-3848. And then we have a texting line, which is also available 24 hours a day, 7 days a week. If texting is your preferred method of communication, that's 716-392-2221. And we also have a virtual peer support warm line. So if you want to video chat with someone, have some face-to-face time, you can call that number, which is 833-361-6130. And then I just also want to say Erie County has done such a fantastic job of compiling resources and making that information available to people. And I know that they have a great information line that's open from 8 a.m. to 8 p.m., and that's 858-2929. And I have to give a shout out to my partners at Crisis Services for their 24-hour hotline and addiction hotline. They are doing absolutely amazing work in helping support the county. And their 24-hour crisis line is 834-3131, and the addiction hotline is 831-7007.
Okay, great. A lot of great information there. And just want to be clear on something. All of those resources that you mentioned, those mental health resources, just want to make sure people understand that those aren't numbers that you can necessarily call and just ask hypothetical questions about COVID-19 or coronavirus. They're specific to what type of calls?
They are specific to either if someone for crisis services, someone who's in a crisis who needs someone to really work through, whether it's a mental health crisis or the addiction line if somebody is struggling with substance use problems. The warm line and the texting line and the virtual line, those are, you need someone to talk to. You're having a bad day. You're just struggling with what's going on in terms of how it's affecting your mental health. And you just need someone to talk to, or you need someone to bounce some ideas off of. Hey, does, this sound like a good idea for helping me, relieve my stress? Or just, you're feeling isolated, you're feeling lonely. Give us a call. We're here to talk with you. We're people helping people. And I keep getting reminded of this quote that I circulating around Italy, that we are standing far apart now so we can embrace each other later. So these phone numbers for these lines are those people who are standing, they're far apart from you now, but they're standing there just to, give you a virtual hug and just to talk about how you're feeling.
Right. That's a great quote. Standing far apart so we can embrace each other later. That's a great quote. And I want to thank you, Dr. Vincent, for your time. We are somewhat out of time now, but before we go, is there anything of importance that we haven't mentioned that you want to stress to our listeners?
I want to stress that I know this is a challenging time, and if you're feeling well, you may not, really understand why the guidelines are what they are, but they are important because we want to help, as many people as possible through this. And the one last thing I want to say, a lot of times the best way to make yourself feel better is to do something for someone else. So maybe you pick up the phone and call someone a friend or a neighbor that might be lonely, donate to the food bank if you have the ability to. With all of the extra shopping people have done, the food bank, low-income families are low on food. And when we do things for other people, it really makes us feel more in control and really helps lessen our anxiety and, possible depression because we have meaning and purpose and we're doing something. People just want to be able to do something. So there's lots of things out there we can do to support each other.
Right, exactly. Dr. Kirsten Vincent is the interim CEO for Housing Opportunities Made Easy, which will soon become...
we are Housing Options Made Easy, and we are rebranding to become Recovery Options Made Easy.
Once again, Dr. Yes. Vincent, thank you so very much for that valuable information you've given us, and stay safe. And if this gets any worse, I'm sure that we'll talk to you again.
I'm always here to chat and to lend a hand if I can.
All right. Thank you very much. Have a great day.
Thank you. You too. Bye-bye.
The views, opinions, and comments expressed on the program are those of the participants and not necessarily of this station.